Are you one of the many men worldwide who are experiencing sexual dysfunction, but don't know where to start seeking help? Welcome, my friends. Today, we confront the challenging realm of male sexual dysfunction. Despite its prevalence, it's often swathed in stigma and misunderstanding. This term is wide-ranging, covering conditions like erectile dysfunction, premature or delayed ejaculation, and low sexual desire. It's not merely associated with physical symptoms but can also impair a man's psychological well-being, influencing his self-confidence, relationships, and overall life quality. This issue is not uncommon, as it is believed that millions of men worldwide face different forms of sexual dysfunction at varied life stages. Age is a crucial factor, with the probability escalating as men age. However, it's not limited to older men. Younger ones can also face these issues. Symptoms can differ, ranging from difficulty achieving or maintaining an erection, decreased sexual interest, to ejaculation problems. It's crucial to understand that sporadic difficulties in the bedroom do not necessarily represent a dysfunction. When these problems become consistent, it might be time to seek help. Here's the good news: you're not alone in this, and it's all right to seek assistance. Medical science has made remarkable progress in understanding and addressing male sexual dysfunction. A plethora of treatment options are available, suited to the individual's needs and situation. So, if you or someone you know is wrestling with these issues, remember, there's no need to bear it in silence. Discussing it, seeking advice, is not a sign of weakness, but a stride towards regaining your sexual health and overall well-being. Now, let's the different treatment options available, starting from the least invasive to the most invasive. Firstly, we have the least invasive treatments, lifestyle changes, and counseling. Allow us to explore the profound influence of lifestyle modifications. Astonishingly, daily habits significantly influence sexual health. For instance, the harmful habit of smoking is known to affect blood circulation, a vital factor for maintaining an erection. By eliminating smoking from your routine, you could witness an improvement in your sexual function. Similarly, excessive alcohol has negative impacts. While a glass might set the mood, too much could lead to erectile dysfunction. The key here is moderation. A consistent, moderate physical activity routine is a fundamental element of a healthy lifestyle that directly influences your sexual health. It's not about strenuous activities but about regular, moderate exercises. This improves your cardiovascular health and boosts mood and energy levels, both beneficial for sexual function. Now on to counseling. Psychological factors such as stress, anxiety, and depression often coexist with sexual dysfunction. At times, these could be the root cause. Counseling can effectively address these. It provides tools to manage stress and anxiety, and can help improve your relationships, enhancing your sexual function. Sex therapy, another form of counseling, focuses specifically on sexual issues. It helps you and your partner to understand and resolve conflicts or misconceptions about sex, improving your sexual health. A combination of lifestyle modifications can bring significant improvements. While these changes can significantly improve your sexual health, there are also medical treatments you can consider. Next, we delve into the realm of oral medications. A common method for treating erectile dysfunction involves medications known as PDE5 inhibitors, which you might recognize as Viagra, Cialis, and Levitra. So, how do PDE5 inhibitors perform their function? By relaxing the muscles in the walls of your blood vessels. This leads to increased blood flow to parts of the body, including your penis, aiding in the creation of an erection when sexually stimulated. These medications have shown high effectiveness for a significant number of men, working in roughly 70% of those with erectile dysfunction. Like every medication though, they can have side effects. These range from headaches, flushing, to upset stomach, visual changes, and in some instances, an erection that lasts longer than 4 hours, a condition that should be immediately attended to. It's also crucial to keep in mind that these medications are not universally suitable. If you have specific health conditions, such as heart disease, or if you're on medication like nitrates, PDE5 inhibitors might not be advisable due to potential interactions or associated risks. Despite this, they present an operational solution for numerous men, helping them to restore sexual function and reassurance. These medications are usually taken on an as-and-when basis, an hour before sexual activity, though the timing can vary depending on the specific medication and individual response. Although it's vital to remember that these medications aren't a fix-all. They don't address the root causes of erectile dysfunction, which could be physical conditions like heart disease or diabetes, or psychological factors like stress or anxiety. Therefore, It's always essential to discuss your symptoms and health with your healthcare provider to find the most suitable and effective treatment. But what if oral medications don't work for you? Don't worry, there are still other options. This excerpt from the narration script has been shortened to 430 words while retaining the first and last sentences as requested. One of these options is the use of vacuum pumps. Vacuum pumps, also known as vacuum constriction devices or vacuum erection devices, are mechanical solutions to a biological problem. They work on a very simple principle of physics. This principle involves creating a vacuum around the penis, which draws blood into the organ, leading to an erection. Think of it like drinking from a straw. When you suck the air out of the straw, the liquid rushes in to replace the air. That's the same concept being applied here. Here, the role of the straw is played by a cylinder that fits over the penis, and the liquid is the blood. These pumps can be operated by hand or battery. Once an erection is achieved, a flexible band is placed around the base of the penis. This band holds the erection after the vacuum tube is removed. This band can be safely left on for up to half an hour to allow for sexual activity. Now, how efficient are these devices? Research has indicated that about 60 to 80% of men are pleased with the outcome of vacuum pumps. This makes them particularly useful for those who cannot take pills due to health issues or potential drug interactions. However, like all treatment options, vacuum pumps also carry their own potential side effects. These might include bruising, numbness, or a sensation of coldness brought on by the constriction band. There's also a slight possibility of damage to the penis if the device is overused or used incorrectly. So, who are the individuals that could benefit from this treatment method? Vacuum pumps are potentially a good choice for men who want a non-pharmaceutical treatment option, or for individuals with specific medical conditions that make oral medications unsafe. They also serve as a feasible option for men who haven't success with other treatment methods. In a nutshell, vacuum pumps can be described as a non-invasive, relatively safe, and effective choice for many men facing erectile dysfunction. But always keep in mind it's crucial to discuss with a healthcare provider to ascertain the best treatment for your particular situation. The conversation with your healthcare provider will also help you understand the potential risks and benefits in a more personalized context. Even if vacuum pumps aren't considered the best treatment option, rest assured there are other more invasive treatment options available. Your healthcare provider will guide you towards the treatment method that is most suitable for your specific condition and individual needs. And if vacuum pumps aren't suitable, there's still another more invasive option to consider. Penile injections and suppositories are a step further in the treatment options. These methods are commonly deliberated when previous attempts with oral medications and lifestyle modifications have proven unsuccessful in the treatment of erectile dysfunction. Intracavernosal injections, or more plainly penile injections, involve the administration of medication directly into the sides of the penis. The thought of this might be intimidating initially, but it's crucial to remember that the procedure employs tiny needles and is typically devoid of any discomfort. The medication operates by dilating the blood vessels in the penis, facilitating an increased blood which ultimately leads to an erection. The success rate associated with penile injections is quite admirable, with a high percentage of men vouching for satisfactory outcomes. However, like any other medical procedure, the possibility of side effects exists, such as mild to moderate pain, bruising, or, in rare circumstances, priapism, a prolonged, painful erection. The other side of the spectrum, we have penile suppositories. These minute pellets are inserted into the urethra, the conduit responsible for urination and ejaculation. This method, referred to as intraurethral therapy, employs a device to insert the pellet about an inch into your urethra. Despite how it might sound, the majority of men report no discomfort. The pellet dissolves and enhances blood flow to penis, resulting in an erection. Although the efficacy of suppositories doesn't quite match up to injections, they serve as a viable option for those apprehensive about needles. Potential side effects could include minor bleeding, a burning sensation, and on rare occasions, the formation of fibrous tissue. Both these treatments have shown beneficial results for men who have been unresponsive to other treatments or are unsuitable for oral medications due to existing health conditions. A detailed discussion with your healthcare provider is crucial to understand the advantages and disadvantages and to determine the most suited treatment plan for you. Lastly, let's look at the most invasive treatment option, penile implants. For those who've tried everything else without success, penile implants could be the answer. These unique implants, also frequently referred to as penile prostheses, are specialized medical devices that are delicately and precisely placed inside the physical structure of the penis. Their main goal? To allow men to achieve an erection when other solutions have proven unsuccessful. They are primarily used as a resort when other forms of treatment for erectile dysfunction have not yielded the desired results. Penile implants come in two key varieties, each with its unique attributes and advantages. The first type of implant is known as an inflatable device. These are the most popular choice among men, and they provide the most natural, rigid erections. They are constructed from two components: the cylinders, which are carefully inserted into the penis, and a separate pump that is placed in the scrotum. When you wish to achieve an erection, you simply apply pressure to pump. This action sends a saline solution into the cylinders, mimicking the natural process of an erection. The second type of implant is a semi-rigid rod. This is a more straightforward device composed of two flexible rods that maintain their semi-rigid state. Rods can be conveniently bent upwards for sexual activity and positioned downwards when not in use. Now let's delve into the effectiveness of these implants. Extensive research and numerous studies have indicated that penile implants have a success rate exceeding 90%. A significant majority of men report satisfaction with their implants, often commenting that they can now engage in sexual activity more spontaneously and freely. However, like all surgical procedures, there are potential complications to consider. These may encompass infection, implant malfunction, or even the erosion of the implant through the skin. Another crucial factor to keep in mind is that once a penile implant is chosen as a solution, natural erections become a thing of the past. So, who stands to benefit from such a procedure? Men who've tried and failed with other treatments, those with specific medical conditions like Peyronie's disease, and those who've previously undergone prostate surgery may be viable candidates for penile implants. It is absolutely essential to discuss this potential solution with your healthcare provider, taking into account all relevant factors including your personal needs, lifestyle, and overall health. As we've seen, there are numerous treatment options available for male sexual dysfunction. And for those who've tried other methods without success, penile implants could provide a new lease on their sexual health. Male sexual dysfunction can be a challenging issue, but remember, help is available. As we delve into the world of male sexual dysfunction, we find it's a complex issue with a range of causes and treatments. Whether it's lifestyle changes, professional counseling, medicinal solutions, or surgical procedures, the choices are numerous. Each solution has its own unique benefits and potential difficulties, and the optimal choice depends on the individual's unique situation. Addressing sexual dysfunction begins with understanding it's a common problem among men. There's no need for embarrassment or hesitation. In fact, proactively confronting it is the key to overcoming it. Assistance from professionals is crucial, as they can provide an environment of safety and confidentiality where you can comfortably discuss these matters. With their knowledge and resources, they can guide you towards effective solutions. They can help unearth the root causes of the dysfunction, which could be physical, psychological, or a combination of both. They can also assist in navigating through various treatment options, aiding you in making the most suitable choice for your individual needs. Remember, every journey begins with a single step. Taking the initial step towards help might seem intimidating, but it's an act of strength and self-care. It's about taking charge of your health and life. It's about striving for a happier, healthier, more rewarding existence. And remember, you're not alone. Many men have embarked on this journey before you, and many more will follow. There's a fraternity ready to provide support, understanding, and encouragement. Engage, connect, share your experiences, learn from others, and draw strength from collective wisdom. Remember, it's your health, and you deserve to lead a fulfilling life. Don't hesitate to seek help if you're experiencing sexual dysfunction. You have the ability to alter your circumstances. Don't let fear or embarrassment deter you. Your journey towards a healthier, happier, more fulfilling life starts now. Thank you for taking the time to watch this video. We hope it has provided you with valuable insights into male sexual dysfunction and the multiple treatment options available. Remember, there is no shame in seeking help. You are not alone in this journey, and there are numerous resources and support networks available to assist you. If you found this information helpful, we encourage you to share this video with others who may be struggling with similar issues. By spreading knowledge and understanding, we can help break the stigma surrounding male sexual dysfunction and encourage more men to seek the help they need. Remember, it's okay to reach out, it's okay to talk about it, and it's okay to seek help. Together we can create a community that supports, encourages, and uplifts each other. We hope you found this video informative and engaging. If you enjoyed it, please consider giving us a thumbs up and subscribing for more content. Your support is greatly appreciated, and it's what keeps us going. Don't forget to hit the bell icon to get notifications for our latest videos. If you have any thoughts or questions, leave us a comment below. We'd love to hear from you. Until next time, take care. Your journey towards a healthier, happier, more fulfilling life continues, and we are here to support you every step of the way.